doctor recommended the Mirena IUD. She said it would be safe, effective, and easy to use. Now you've found out that your Mirena IUD has perforated your uterus and you're going to require surgery to remove it, with possibly risking the loss of your uterus. Do you have a case against the manufacturer of Mirena? My name is Stuart Scott, a pharmaceutical and medical device lawyer here in Ohio. As you probably know, Mirena is an IUD manufactured by Bayer. It is inserted by your doctor in an office procedure that's fairly routine and takes about 5 minutes. It provides hormonal birth control. And like all drugs, Mirena has certain side effects and risks. The law says that a manufacturer of a drug has to provide you and your doctor with all of the known side effects and complications. This is because your doctor can then understand what the risks are, discuss those risks with you as the patient, and you and your doctor together can figure out whether it's the right decision for you. So how do you know whether this side effect is caused by the fault of Mirena? Well, number one, women who have just given birth should not receive the Mirena IUD. During the first 6 to 12 weeks postpartum, the uterus is still contracting, and the insertion of the Mirena product could result in perforation. Second, women who are breastfeeding also are not candidates for Mirena. This is because studies have shown that women who are breastfeeding, even several months after postpartum, are still at risk for having a uterine contraction. The other issue is, when did the perforation occur? One of the risks of the IUD is that when your doctor inserts it, he or she may insert it in a way that causes the uterine to rupture. How do you know? Well, within about a week or two after its initial insertion, the doctor should have you come back for a follow-up visit. The purpose of this follow-up visit is to either do an X-ray or an ultrasound to determine exactly where the Mirena device is. Mirena is designed in a way so that a plain film X-ray or an ultrasound will give a very high resolution picture so that the doctor can see exactly where it is. If it's where it's supposed to be in the uterus, then everything is fine. The second way that the doctor can tell if it's in the right position is that there is a string attached to the bottom of the Mirena device. If the doctor can find the string in its correct location, then one can safely assume that Mirena is in its proper position in the uterus. If the string can't be found or it's not where it should be, then your doctor needs to investigate why, because it might be that the IUD device has migrated in the uterus and perhaps even has penetrated the uterine wall. If everything checks out on this follow-up visit, then according to Bayer, you should be fine. There is absolutely no warning that your Mirena device is going to cause any injury to your uterus. But here's the problem. Hundreds of women are finding out that they're suffering embedment of the IUD device or perforations of their uterus months after it's been inserted. You might have questions about your own Mirena case. If you do, call us. We have the answers. We've been answering these questions for years.